Hi everybody, welcome to Little Info and I'm SudhaSrinivas. Today the topic that I'm going to share with all of you is about the fungal infections that has been going around. That is the black, white and the yellow fungus. So today, more than the infection, more than the symptoms, more than how it is doing in different states, so more than all of this, I'm going to talk about the precautionary measures and certain do's and don'ts that has been told by certain doctors so that we can avoid these infections. So that is what I'm going to share with you. So I'm going to focus more on these precautionary measures so that it is helpful for all of us to follow. Okay, so these guidelines or these instructions are given by famous doctors, popular doctors. Okay, so let's get started. So please watch the video till the end so that you can get the complete information and take all these precautionary measures and stay safe. Let's get started. So starting with black fungus. Now black fungus, it is basically caused by mucormycetes, and that is a type of fungi which is present in the environment. Environment, I mean leaves, soil, compost, even in animal dung, and also, why not, even in the air. Okay, so because it is even found in the air, leaves, soil, is it present or it is only started now after this pandemic? Was it not there before? Yes, it was very much there even before this pandemic, even before all this corona. So this disease, that is the black fungal infection, was there in our country right from the beginning. Okay, but it was a very rare fungal disease because normally we used to have around 20 cases in a year. But now we have around 9,000 to 10,000 cases. Now, why is there so much of rise in these cases? I will tell you that. Now, there are certain reasons as to why this infection has increased. Now, before that, I would like to give you a statement which is mentioned by a doctor, that is Dr. Bhujang Shetty, who is the head of Narayan Netralaya. He has said that bacteria or fungus are already present in our bodies, but they are kept in check by the body's immune system. When the immunity levels decreases, these bacteria or these organisms take an upper hand. So this is what he has said. So this itself tells the main reason for these fungal infections. So when the immune system reduces in our body, that is when these bacteria or these infection takes a major hand. So that is why the main reason being suppressed immune system, weakening of immune system, and also overuse of drugs. Okay, because of these factors, our immunity levels have decreased and the chances of these fungal infections have increased. Now, why and what are the factors that have been given more room for these bacterial infections? Less of oxygen, because patients suffering from this COVID, because of all these factors, the oxygen levels are decreasing. Diabetes, one of the main factors, because most of us in our country are suffering from diabetes and it is not always under control. And when we are taking certain drugs like this to combat COVID and other diseases, that is when our immunity levels again decreases, and again the chances of these infection increases. Okay, and prolonged hospitalization with mechanical ventilators. So when these mechanical ventilators are used, are they really in a very clean and cleanlier manner? So that is again a question to be asked. Is it very clean? These oxygen cylinders, these ventilators, so even the pipes, the small little pipes in that, so they also contain a lot of bacteria if they are not neatly maintained. So that is also again another reason for these bacterial infections. Now when I say bacterial infections or these fungal infections, I am talking about all the three. Okay, that is, I'm talking about black fungus, white fungus and the yellow fungus. Now black fungus, as I told you, it is caused by the mucocytes. That is also a type of fungi which is present everywhere. And what happens during this? What are the symptoms? Nasal blockage, discharge from the nose, there is facial pain, there is swellness and numbness, okay, in the face and in the eyes. There is blurring of vision, watery eyes, and why not even a toothache. Okay, and what about white fungus? Now white fungus is also called as aspergillus. This is basically a fungus which is present on the bread. Okay, when you see the bread which is stale, okay, which is after some 4 or 5 days the bread becomes stale, right? So you can see fungal formation on that. That fungal formation is this white fungus. That is what a doctor has said. Okay, now this infection again starts from the tongue. There's all white patches are being formed on the tongue and it spreads to other parts of the body as well. And there is also white patch formation on the oral cavity also. Okay, and what about this yellow fungus? Now, yellow fungus starts internally. There is actually a kind of pus formation which happens in the internal organs and which slows down the healing of lot of wounds. Okay, now why this name yellow, white, black? Is it because the these fungi are in different colors? No, these fungi are all similar, but the symptoms that occur because of these infections are of these colors. Now, if you take black fungus infection, the patient who suffers from this infection, their skin and their certain body parts turn to color black. Okay, so parts of the body like nose or near the eyes, there's always a swelling. Also, some people also suffer from discoloration in the hands as well. So their hands, the skin, and the eyes and nose turns to black color. And coming to white fungus, as I told you, there is white patches which is formed on the tongue and the oral cavities. And yellow fungus, because of the pus formation, it is called as yellow fungus. So these colors or these names have been given to them is just because of the symptoms. Otherwise, the reason for all these fungal infections are similar. Okay, there is loss of appetite, there is loss of weight, loss of energy also, lack of energy, and there is also disruption in the digestive system. These are the symptoms of all these three kind of fungal infections. Now, having spoken about all of these, so what are the reasons that I told you? Basically because there is prolonged hospitalization, people are hospitalized for a long time, there is overuse of drugs, okay, to combat corona, and also there's overuse of steroids in certain cases. So not just drugs, not just ordinary medicine, so most of the cases they have been prescribed steroids also. So overuse of all this, and most importantly unhygienic practices and not a cleaner environment is also giving more room for these fungal infections. Okay, so speaking about this, is this really a contagious disease? Not really. This black fungus, white fungus, and yellow fungus, this is not really contagious. It cannot spread from a contact with human beings or from animals. No. But does it spread from the air? Yes, of course. Okay, it does spread from the fungal spores which are present in the air, and that is unavoidable. Okay, now who are the people who are at risk? Because if it is in the air, all of us are inhaling this, all of us are touching many things in and around there. So who are the people who are at higher risk? So people with very low immunity levels, people who have recovered newly from COVID or who are still under the treatment of COVID. Okay, and also people who are a little elderly, and also people who are diabetic. Now these are the people who are at higher risk of these infections. Okay, so please watch for these factors, and if you are any person who are suffering from these, please take the precautionary measures. Very, very important. This infection cannot be treated at home. Okay, now the mortality rate here is around 54%. Okay, it depends on the condition of the patients, on which are the body parts this infection has affected. So the mortality rate is 54%. Now in certain cases, surgery is also done to remove the fungal infection so that it does not spread to the other parts of the body. So it cannot be treated at home. So self-medication really not possible. You will have to take doctor's consultation immediately. But if certain do's and don'ts, or if certain precautionary measures are taken well in advance, then all this can be cured very easily. So please do listen to this. Okay, now what are the most important precautionary measures? Is good hygiene and cleanliness in the surrounding, the most important and the first most thing. Okay, and when I say good hygiene and cleanliness, I just don't mean the environment and the surroundings. I am also talking about the mask that we use. Now all of us are using mask, but how hygienic that mask is very important. So using a mask without washing it for more than 2 or 3 weeks can cause black fungus infection, is being told by Dr. Devi Shetty. Please make a note of it. Use a mask which is very clean. See to that you wash it properly and you use it. Okay, oral hygiene is always important, so regularly do your mouthwash and also gargling with salt water. Use sterile water for humidification, just not any tap water. Okay, keep the room and keep the house where the patients are, or for the normal people who are with low immunity, keep it really humidified. Okay, Steroid usage should be limited because more use of steroids will suppress the immune system, and that will again give a lot of chances for the infection. Avoid unnecessary use of antibiotics and antifungals without your doctor consultation, or if your doctor has prescribed it for 3 days, please take it only for 3 days, or if he has told you not to do it, please don't do it. Okay, just go according to your doctor's advice only. And also, please see to that your sugar levels are always under control if anybody is diabetic here. Okay, and a few more things for people who have newly recovered from COVID. If you are a person who is newly recovered from COVID, try to always stay indoors and do exercises or workout. Please do not try to avoid your exercises or workout because your body needs those physical activities. Avoid construction areas, fields and grounds. Please do not step outside because those areas will have a lot of bacteria, fungus, dust, which will again cause irritation. Okay, avoid gardening as soil and plants are abound with these fungi. If it is really unavoidable, if you say you have to do it, you have no other go, please use your rubber gloves, masks and your boots while you're in your garden. Okay, but apart from these, there are also certain other things, most important factors that is given by Dr. Deeptarka Bhattacharya, who is from Apollo Spectra Hospitals. So what are those things? Those precautionary measures, those do's and don'ts. Use saline nasal drops. Saline nasal drops are very important because it will wash away all the fungus in the pores. Okay. Do not use xylometazoline kind of nasal sprays like Otrivin or something. Please avoid using them for some time. Okay, because that will decrease the blood supply and it will increase the chance of infection. So for some time, if you feel your immune system is low and you are newly recovering from COVID, please avoid using this. Okay, use only saline nasal drops, and do not use steroid nasal spray. Okay, for your to your nose at least for 15 days. And stop your steroid inhalers also at least for a week. If you are a person who is already on all these inhalers, please try to avoid them for at least a week or so. Now always do a quick vision check. Always keep tracking your eye movements. Okay, if there is any change in your vision, if you're not able to see colors like red, blue, yellow, and if there is any loss of smell or anything black on the roof of your mouth is seen, please visit your ENT immediately. Okay, so these are most important things that doctor has prescribed. So these are the factors which are very, very important to be maintained. Okay, so very simple to avoid all these infections. Simple things: keep your surroundings clean, always try to wash your masks and wear it regularly, and try to increase your immune system. How do we increase our immune system? Again, vegetables like mushrooms, tomatoes, bell peppers, broccoli, spinach are all very important to increase your immune system. Please do intake all this, include it in your intake. So include ginger, gooseberries, turmeric, garlic, cumin, flax seeds, pumpkin seeds, melon seeds. These are all very good source of vitamins and proteins, and it also has properties to fight against these bacterial or fungal infections. So very, very important thing: eat right, do your physical activities, do your physical workout, take care of your mental health. That is also very important. Enough sleep is most important. Reduce stress means your immunity will increase, which will reduce the chances of infection. So 7 to 8 hours of sleep, very, very important, and 8 to 10 glasses of water a day, most important. So applying ghee and coconut oil to your nostrils in the nose will help it make it clean. Okay, so eat right, do your physical activities, take care of your mental health, avoid lot of stress, get enough sleep, keep your surroundings clean, increase your immunity level, very important, and maintain humidity of around 30 to 40%, and avoid over usage of steroids. Now all this will help you in avoiding these infections. Okay, even if any person who is infected with these, if you take these precautionary measures, you can easily come out of it healthily very soon. Okay, if you think this video was informative, please share it, give a comment, and also subscribe to the channel if you haven't subscribed yet. Okay, to listen to the same content in Tamil, please click the link below. Thank you.